Antimicrobial resistance, AMR. Antibiotic resistance is a global reality. It is associated with increased mortality, prolonged LOS, higher costs, and increased antibiotic use. It is estimated that each year 25,000 patients die of infections caused by AMR pathogens, many of them in the ICU. By 2050, infections caused by AMR will be the leading cause of mortality globally, surpassing cancer, with an estimated 390,000 deaths in Europe. ICU patients are at increased risk of developing infections caused by AMR pathogens due to the intensity of the treatment, the use of invasive devices, increased risk of transmission and exposure to antibiotics. Despite this threat, the tide can turn on AMR in ICUs for a number of reasons. Knowledge of the development and spread of AMR is increasing. Technologies are available to rapidly diagnose infections and document the involvement of AMR pathogens. New antibiotics are becoming available that are particularly aimed at AMR pathogens. Non-antibiotic strategies to treat severe infections are under development, and the importance of infection control in hospitals is now recognized, and infection control programs are controlling the spread of AMR infections. The Antarctica Coalition unites specialists from the European Society of Intensive Care Medicine, the European Society of Microbiology and Infectious Diseases, and the World Alliance Against Antimicrobial Resistance. The coalition has identified priorities to improve AMR infection management in the ICU and is now calling for increased awareness and action among intensive care and healthcare professionals to reduce AMR development in critically ill patients, to improve the treatment of AMR infections, and coordinate scientific research in this high-risk patient population. 3 strategies for appropriate antibiotic therapy that you can start using today are: avoid the use of antibiotics for inflammation without infection, reduce, whenever possible, the duration of antibiotic treatment, and stop the unnecessary use of broad-spectrum antibiotics. Administer the optimal dose of antibiotics when antibiotics are needed. Tackling AMR is a responsibility shared by all healthcare workers.